We are here today because the HICWA review has laid bare significant failures at Children's Health Ireland, failures that I believe have put children at harm. Children who deserved the very highest standards of care were failed in process, duty and responsibility. We must confront that failure openly, honestly, and with a determination to make sure that it doesn't happen again and to regain trust. Every year, hundreds of thousands of children, accompanied by their parents, guardians and other loved ones, walk through the door of CHI hospitals. They come needing and seeking care and support. CHI aims to provide high-quality paediatric care that is appropriate to the needs of those children so that they have the best chance of reaching their highest potential throughout the rest of their lives. And across many disciplines and across many areas, that does happen. Since 2020, Children's Health Ireland operational budget has increased by 52% to €586 million in 2024. CHI has also grown its permanent staffing cohort from 3,545 whole-time equivalents in 2019 to 4,464. That is a 26% increase. That additional funding supported the development of new services, including 6 new neonatal high dependency beds in preparation for an enhanced NICU service in the new Children's Hospital and the opening of a 5th theatre in Temple Street. It also funds the current activity being provided by CHI. The scale of activity in CHI is significant, with over 80,000 emergency visits each year, 50,000 urgent care centre visits, 50,000 inpatient or day cases, and 140,000 outpatient appointments. But behind every number, behind every statistic, is obviously a child with all of their care needs. It is our responsibility to provide that care and to make sure that care wraps around that child, integrating clinical excellence with emotional support, developmental understanding, and a sense of real partnership with families. And while we continue to provide services and drive reform, we need to address the failures of the HICWA review head-on, to identify issues, to rebuild trust and to ensure that reform remains centred around putting the child and their family at the very heart of our paediatric services. The HICWA report published 3 weeks ago was a stark reminder of what happens when safeguards fail. The report found that springs implanted in a small number of children during spinal surgery between 2020 and 2022 were not CE marked. HICWA found that the controls in place within CHI for the management of the end-to-end processes did not provide adequate safeguards at each stage of the process. And the report clearly shows that the use of non-CE marked springs as surgical implants was clearly wrong. Those children were not protected from the risk of harm as they should have been. What happened to those children, to the children involved, was wrong. It should not have happened. It should not have been allowed to happen. And I offer my deepest regret for the distress and anxiety caused to the families, and both HSE and CHI have apologised to the children and to the families affected by those issues. The chairperson of the board has stepped down from his role as chair. I have asked my officials to work with the board to ensure that a new chairperson and a new is appointed over the coming weeks. What we need now, for a number of different reasons, is stability, to ensure that CHI implements the recommendations from the HICWA review and also brings us to the opening of the new hospital. And we need the underlying governance structures to ensure that those things happen. But we owe it to those children, the subject of the HICWA review, and to every child in our care, to make sure that safety systems are not only strengthened now, but embedded even more deeply across every part of the organisation. And I want to assure everybody here and outside of this House that I am totally committed to dealing with these issues. When I met with the board of CHI 2 weeks ago and again this week, after the publication of the report, I made very, very clear, as I'm sure deputies imagine I would, my deep disquiet, my deep dissatisfaction and unhappiness at what happened. Such gaps in governance and management are not acceptable, and that is why the recommendations of the report must be fully implemented as quickly as possible. I expressed my clear expectations in terms of reform to ensure that it does not happen again, and both HSE and CHI have accepted the recommendations in full, and I have insisted on the full and rapid implementation of all 19 HICWA recommendations. The HSE CEO and his team are meeting regularly with the CHI CEO to ensure those recommendations are being implemented without delay. I received an update on the implementation of these recommendations on Friday, which I then discussed with the board yesterday. CHI advised that a quality improvement plan is in place to address the recommendations, and that plan outlines 32 actions to address the HICWA recommendations. 18 of those actions are now complete, which is 56%. A further 12 are partially complete or in progress, and that includes the development and implementation of a medical device management system. Overall, over 90% of the actions are complete or in progress. CHI has advised that updates on that quality improvement plan will be published quarterly on the CHI website to ensure openness and transparency. But of course, also as Minister, I will be getting updates, and I know CHI will continue to be working with the HSE CEO to do that. I am extremely conscious that the NIAGAM report is still underway. I understand that it has progressed and is now subject to the time required for due process and fair procedures, but I think everybody in this House would expect that it would be completed shortly. Separately, as deputies are aware, a clinical audit of surgery for children with developmental dysplasia of the hip is being conducted by an international expert paediatric surgeon. That audit, which is assessing surgical practice across CHI and the National Orthopaedic Hospital in Kappa, is nearing completion. Both CHI and Kappa are committed to sharing the findings of the audit once complete, of course. CHI and Kappa have issued letters to the families who may have concerns to provide information and reassurance as the final report is awaited. Currently, patient safety precautions are in place for any planned developmental dysplasia of the hip surgery through an enhanced multidisciplinary team pre-operative decision-making process across CHI and Kappa, and that team commenced work in the first week of March 2025. The learnings from these reviews are informing the development and improvement of services and a building, I hope, of some confidence and trust. But I do know from my own instinct, from my own discussions with yourselves and from my discussions with advocacy groups that obviously much more work needs to be done. I have listened, of course, to advocacy groups. I have listened to deputies who have raised different cases with me, and thank you for doing so, and thank you for continuing to engage with me on a private basis, raising cases, because it is so helpful, and I greatly appreciate deputies working with me in that way. But I have listened to advocacy groups and the historical experiences that they have experienced, both themselves and on behalf of their members whom they more broadly represent, and indeed TDs. I met the chair of the Paediatric Spinal Task Force some months ago, and then I attended their first meeting, which happened to coincide, their next meeting, which happened to coincide with the publication of the CHI report. And at that meeting, of course, I had the opportunity to speak with groups of advocates for people who have spina bifida and for people who have scoliosis. I heard directly from them, and I was really struck by this, about the impact that the publication of this HIPCO report had on their personal experiences, on their trust in the system and their experience over time, and the hurt that they have experienced over many years. Yesterday and today, I again had the opportunity to meet in a more deep way with advocacy groups, and in person, not online like the task force, with advocacy groups representing children, young people and families affected by spinal conditions such as scoliosis and spina bifida. And I do want to thank them sincerely for their time, their presence, their honesty, and above all, their unwavering dedication to improving services for those who need them most. During our meetings, I really listened closely to what they said, and they speak clearly and powerful, as I know deputies will already know, about the impact that long waiting times, delays in treatments, and crucially as well, gaps in communication can have. These issues affect not only the physical health of their children, but their emotional well-being, their development, and the everyday lives of entire families. And their message was clear: more needs to be done, and it needs to happen urgently. And I want to state publicly what I said to them, which is that I am resolute in my commitment to addressing the issues raised. Every child deserves timely, safe and effective care, and the stories that they share with me only strengthen my determination to drive further improvements into access, capacity and patient communication within our spinal services. We have seen progress in recent years, but I do seriously recognise that it is not enough progress. Nevertheless, progress has happened, and I recognise the experience also of those many children who have had surgeries in the last number of years. And in that sense, I'm very conscious that this isn't about numbers. This is about children. It is about ensuring that no child is left waiting, no young person is left waiting. And it is about making sure that every part of our health system, including spinal surgeries, meets their needs, respects their dignity and supports families at every step of the way. And to the families and advocates who have spoken with me, your voice has left a deep impact, and I'm determined to ensure that this service improves further. One thing that was made very clear to me, and one thing that I wish to make abundantly clear to CHI and to everybody working in paediatric services more broadly, is the importance of communications. I recognise the importance of clear, compassionate, proactive communication with families, with patients, cannot be overstated. The importance of timely communication about changes that can happen for different reasons, that can naturally happen, but the way in which these messages is delivered is so important to families who are out of control in other aspects of the care of their lives. I recognise, for example, the impact and the cost of attending an outpatient appointment in terms of coming from a different part of Ireland, not Dublin, and having to take perhaps a day off work to arrange childcare for other children. the cost of petrol, the cost of the other it's the range of different costs, but also the emotional cost of planning for a particular outpatient appointment and for some reason it not happening and being told that at short notice. That to me is just simply not forgivable. It mustn't happen, and communication, I make this abundantly clear, must continue to be improved. There have been some improvements. For example, CHI has launched a scoliosis information hub for children and young people. There is a more focused communications plan, but I really want to make this abundantly clear in relation to communication. We have invested in theatres, we have invested in surgeons. Those things can take time, and some of those things can be difficult. There is nothing difficult about picking up the phone correctly in a proactive way, in a way that supports families and doesn't add to distress, and I want to make that absolutely clear. There is a new spinal patient advocate liaison coordinator who has been appointed with a dedicated role to strengthen that communication, and I have asked advocacy groups, and I ask them here again today, to continue to feedback on how that is going and how we might further improve communication on those issues where it hasn't been good enough. On spinal services more directly, I know that people who have acknowledged that there have been some improvements in spinal services, and I acknowledge that, of course, and particularly acknowledge the experience of people who have had surgeries, and that has to be recognised. But it is just simply the case that we simply need to continue to improve access to spinal surgery. Now, that has been the focus of sustained, determined efforts over several years, and we have seen tangible progress. But at the same time, too many children still wait too long, and that is not acceptable. And that commitment to improve access must remain firm. Every child in Ireland deserves access to the care they need when they need it. Scoliosis affects about 1% of children and adolescents in Ireland. And while many of those children don't in fact require surgery as such, for those that do, timely access to treatment is of course critical. For those children who do need surgical intervention, the waiting lists are too long, and that's different depending on the nature of the surgery and the level of complexity of the surgery, but nevertheless they are too long. And I am aware that the burden that places on young patients and the human impact behind that time. At an operational level, in terms of increasing capacity, at an operational level, the establishment of the Paediatric Spinal Surgery Management Unit within CHI last year marked an organisational step forward, and that dedicated team is responsible for coordinating spinal surgery services across CHI at Temple Street, Crumlin and the hospital at Kappa, and it works closely with multidisciplinary teams to ensure the efficient scheduling of procedures and appropriate prioritisation of patients based on clinical need. That's the intent. Efforts to expand capacity within CHI are also progressing. The implementation of ring-fenced theatres, dedicated orthopaedic beds has helped ensure that children requiring spinal surgery are seen more quickly. I note that the impact of additional outpatient clinics, which are being run to assess new patients more promptly. Since April 2024, over 600 new patients have been seen in those clinics, therefore reducing the time those children have been waiting to be seen by a consultant. And there is a dedicated referral pathway for GPs, which has been introduced in urgent cases. Alongside that, national and international outsourcing arrangements have been expanded. For non-complex spinal procedures, pathways to Blackrock and to Kappa are being used to free up capacity in CHI then for more complex cases, which is important. And over 20 children have used those pathways since the beginning of this year. The National Treatment Purchase Fund continues to support diagnostics and a wide range of procedures that enhance capacity for spinal surgery, but internationally, partnerships with Morgan Stanley's Children's Hospital in New York and Great Ormond Street in London have provided care for 16 patients since April last year, with more scheduled to travel this year. And I did meet the team from New York when they were here in the last number of weeks to meet patients and to get a sense from them about how much more could be done and how that was working and how we might improve it further. The families that do choose that option and also for whom it is clinically suitable, because of course it is not suitable for every child to engage in international travel depending on the different pressures that they face. For those for whom it is suitable and for whom it is offered and they accept it, we try to fully support those children in accessing the pathways if it is the right option for the families. There is then also the question about the transition from paediatric to adult services, and CHI is now collaborating with the Mater Hospital on the development of a transitional adolescent spinal service. Joint outpatient clinics have begun supporting patients as they shift to adult care pathways with more continuity. In terms of investment, The House is already aware that in 2024, 52 new full-time equivalent posts were approved to strengthen paediatric spinal surgeons, including services, including surgeons, anaesthesiologists, nursing staff, allied health professionals and administrative support. 22 of those staff are already in post, and recruitment is ongoing for the rest. And I do wish to see that recruitment progressing as quickly as it may. I am aware, of course, that in order for a recruitment process to be successful, you need applicants and you need it to progress, but I'm watching it very closely. Of those that have been put in post, that includes 4 additional orthopaedic consultants. In addition to that, 11.6 million has been allocated to the international outsourcing initiatives. This investment builds on previously committed funding on the Waiting List Action Plan, which is, of course, as deputies are aware, a multi-annual approach through the National Waiting List Action Plan, which combines immediate capacity building with longer-term structural change. The 2025 plan, published in February with a budget of 420 million, again tries to prioritise as best it can scoliosis and spina bifida services. Under these plans, additional posts have been funded and new infrastructure has been completed, including a 5th theatre in Temple Street, an additional MRI scanner and 24 beds. This investment and these initiatives have delivered some tangible results, but against a backdrop of very considerable need. I recognise that, but I make these points to recognise those people who have had surgeries, those people whose experiences have improved. So, for example, I recognise that in 2024, 513 paediatric spinal procedures were complete, which is an increase from 10% in 2023 and a 35% increase in 2019. But again, I recognise that that number needs to be higher again this year. In addition, in 2024, the total number of children actively waiting for spinal procedures reduced from 127 to 108, a decrease of 15%. But again, I say these to recognise, A, the work that has been done, B, some improvement in it, and to recognise very seriously the considerably expanded work that needs to be done to meet the need that is there. What I believe matters more than the number of children waiting is the length of time that they're waiting, and I make this point again and again. Now, what we want to achieve, of course, is the Sláinte care targets of 10 weeks, no more than 10 weeks for an outpatient appointment, no more than 12 weeks for further intervention in an appropriate way. Those should be our collective targets because that's what we have in Sláinte care. But I realise that we have a figure of 4 months, which has been a metric for some time that we have used. In 2024, the number of patients waiting over 4 months dropped by 37%. Those waiting over 12 months dropped by 59%. As of March 2025, 68 children had been waiting over 4 months on the active waiting list, and that's a 22% reduction compared to the same period in 2024. But let us not let any of those numbers mask the ongoing reality that too many children are still waiting. The expected impact on the waiting times, though, through increased activity has been offset in some ways by a significant increase in demand and referrals compared to previous years, which may happen. The additional outpatient clinics seeing new patients are resulting in an increase in referrals, which is appropriate. And up to the end of March this year, 110 children have been added now to the active surgical waiting list, an increase of 43% on the same period last year. That reflects a growing need, a growing population, but it also the outcomes of a faster outpatient access, a more targeted referral pathway as well. So again, my focus is always going to be on the time, not the number, because as population increases and as correct referrals increase, that number should increase. So I also want to acknowledge that there is an increased complexity, or it is told to me that there is an increased complexity of cases presenting at CHI, and that is because in many ways the less complex cases or the more straightforward cases are being referred to other hospitals to try to free up capacity in CHI. So CHI is managing children who require much more complex and also multi-stage surgical interventions. Those children may undergo several procedures, for example, which may not result in a reduction in the waiting list numbers, but that's not important. The point is that some of those more complex cases are now being centred in CHI. They may result in multiple surgeries. So 513 surgeries is not necessarily 513 children. Do you know what I mean? It's more complex than that. But this is why. I have made it very clear to those responsible, including myself, obviously as Minister for Health, but specifically the CHI board, the CHI CEO, and indeed I would say this to the orthopaedic teams more broadly, that we all need renewed urgency on this. And I have made that point repeatedly through my meetings in the last number of weeks since my appointment. While the ongoing development is important, it is part of a broader journey, one that leads to a different model of delivery at the new Children's Hospital. Now, as we are aware, the new Children's Hospital is one of the most significant investments made in health and well-being of our children. I recognise today, for example, Sinn Féin have brought in a bill that recognises that the naming the hospital at some time. I'm very much looking forward to that day when we get to celebrate that together. But meanwhile, we have a significant body of work to do to make sure that that happens. So while it stands as the most significant health infrastructure development since the foundation of our state, it is also a setting a vision for how we want services to be delivered and in the most efficient way. So the state-of-the-art hospital is central to that reform of children's health services, and it is aligned with the ambitions of Sláinte Care, where everything comes under one roof. And it's not, when I mean everything comes under one roof, in terms of clinicians, but also researchers, educators, care teams working side by side in a single facility. And I hope that the impact of the hospital will extend beyond its physical walls. But look, why don't we discuss that when it's open and not in an advanced way, because there's so much work to do to get it open. But crucially, one of the things that I think is really important in getting it open is that this will be a digital public hospital with an integrated care experience that is enabled and improved by supported technology. There will be 473 beds in total, as deputies are already aware, including 380 inpatient beds, 93 day beds. It does expand our capacity to meet clinical demand, including crucially the fact that it has 22 theatres and procedure rooms, which is a 47% increase over current provision, ensuring, I hope, faster access to surgery, a more efficient surgery, coordination and reducing in wait times for really life-changing interventions. It also delivers a major expansion in critical care, which is appropriate, with 60 critical care beds, 20 paediatric, 18 neonatal and 22 for cardiac care, and that is an 88% increase on existing capacity. That is absolutely crucial. And of course then there's 20 dedicated child and adolescent mental health services beds, which is a very important part of children's broader health. As deputies are aware, one of the hallmarks of the hospital is the enhanced comfort and dignity that I am absolutely certain will be the case for families. Every inpatient is cared for in a private room with an ensuite and space for a parent or guardian to stay in more comfort. Critical care and CAMS units will also offer ensuite rooms with nearby accommodation to support families during some very, very difficult times. The digital piece is at the centre of the hospital's design. Every child will have a digital health record, and that shared record enables better coordinated access between radiology, and cardiology and respiratory services. This is absolutely central to how we move forward. This will be every child will have a digital health record. Families will have secure access to a dedicated app that allows them to view their records, manage appointments and receive more timely updates. And it will be Ireland's largest electronic record deployment to date. But as we focus on this renewed infrastructure, it is important to remember what the hospital represents. It's not just a building, it's intended to be a transformative development in how we deliver care. We are already seeing this new model of care come to life through two of the satellite centres, which are already working at Tala and Connolly, which are now open and delivering successfully delivering ambulatory care to children across the Greater Dublin area. And those centres, there's no question, are easing pressure on emergency departments and proving the value of ambulatory care. Delivering the hospital, though, and I want to be very, very clear about this, delivering the hospital remains an absolutely top priority for the government. In October 2024, BAM Ireland and its parent company, Royal BAM, committed to the goal of substantial completion date of mid-2025. I personally sought confirmation that the key areas to enable early access for CHI would be completed to the necessary standards and when they would be made ready by BAM. I sought reassurance that all necessary resources were being deployed by the contractor to support our shared ambition to get that hospital open as soon as possible. Once substantial completion is achieved, the hospital will be handed to CHI for operational commissioning. This is a really complex and critical phase that will involve the installation of more than 36,000 pieces of clinical equipment, integration with the electronic health record and training in the hospital, different training of over 4,000 staff from 3 existing hospitals. There are 4,600 clinical spaces to prepare, and it is a task of some scale. CHI is already in the pre-commissioning phase and progressing, and yesterday I met again with the CHI board to discuss the transition to the new hospital and their plan in relation to the commissioning and the issues and how they might be sequenced all of the time to deliver the most timely, safe opening of this hospital. I want to acknowledge the work that is done to date, but really our focus together, without any question, is simply the delivery of this hospital and supporting the staff and the people who work within our health services into moving into that hospital, making sure that the digital records work well and making sure that it is opened in a timely and safe way. I really do want to reiterate to this House and to the children and families listening my commitment to improving services in spinal surgeries in particular for children and young people by reducing waiting times, ensuring that children receive safe and high quality care. I acknowledge... Sorry, am I finished?
No, I only need 5 minutes.
You're sharing...
Yeah, no, I 5 minutes. You walk away, Minister.
Okay. Sure.
5 minutes.
Forgive me, yeah. My focus is on the opening of the hospital, the detail of the work of improving capacity in spinal surgery, in spinal surgeries, making sure that the posts are recruited, for which we've already funded, that they are recruited, making sure that communications is substantially improved, that people are not let down in that way, making sure that people can have confidence. Of course, I will come to the House at the earliest opportunity that I have received the different reports that we are yet outstanding. I cannot speak about them before then because I have not received them. And I can't speculate about what they may contain. But I do, we all share the vision of opening this hospital. We will all be there together in opening the hospital. There is a very serious body of work to be done to make sure that that happens. And at the same time, we need to make sure that we are increasing capacity in spinal services, that the increased capacity that has already been given to the government is being used and realised by CHI and by the surgeons to transform and improve the lives of children with scoliosis and spina bifida in particular.